Welcome everybody to this webinar today, brought to you by the Houston Area Safety Council and the University of Texas School of Public Health. We've got a great webinar today. This one is on personal care establishments. We've got some great guest panelists on today to talk about their individual personal care establishments, so we're excited to have their feedback. So again, welcome. If this is your first time joining us, welcome. This has been a series of webinars that we've tried to bring to you on different sectors of the workplace industry. So we've had some great discussions, and we know that today's is going to be no exception to that. On your screen, you should see a section in which to type in questions. So most of our webinar today is based on those questions that you send us. So feel free to type in those questions. And we're going to answer them and answer all of them as much as we can. So without those questions, this webinar can get a little boring. So we encourage those questions because that's what keeps our discussion going. Like I said, Houston Area Safety Council and the University of Texas School of Public Health have collaborated to bring this educational series to the public. So we thank you for being here. Both of our mission statements have to do with the well-being, the health, and the safety of the workplace. So what better topics to talk about than keeping our customers safe when they enter our personal care establishments. Thank you to our platinum sponsors at HASC. We couldn't do these types of endeavors without you. We thank you to the sponsors and the donors of the University of Texas as well. Again, without that participation and giving, some of these things would not be possible. So thank you to our sponsors and our donors. A brief agenda. We're going to go over a little bit about what Governor Abbott has rolled out in the state of Texas as far as his mandate and what these types of establishments have to do. We're going to go over the current trends of this virus as it relates to Texas and some local areas. Going to go over some correct use of terminology, what it means to wear a mask versus a respirator versus a facial covering. What are the current CDC guidelines telling us about this virus? It changes almost daily, so we're going to give you the most up-to-date information on how this virus is doing. But more importantly, the webinar is geared to question and answer. So again, type in those questions. You can start typing them in right now. And when we get to the Q&A part of the webinar, we're going to go through those and answer them for you. Here is our list of the panelists and our guest panelists today. You can see a wide variety of experts from the University of Texas, as well as the expertise of our guest panelists. And I'm going to turn that over now to our UT panelists to introduce our guest panelists.
Great, thank you. Well, I'm really excited that both Janet and Enrique Chaides, the owners of Chaides Coiffure in El Paso, could join us today. They have more than 20 years of experience in personal care services. They have trained a lot of folks in El Paso and in the region who provide such services, and they're mentors to many. So I'm so happy that they could join us and provide their insight.
Thank you for having us.
Yeah, and I would like to introduce Victor Guerra, or commonly known as Coach Vic. He is the San Antonio Regional Coach for Orange Theory Fitness. And if you're not familiar with Orange Theory, this is a franchise of boutique fitness studios based out of Boca Raton, Florida. And the chain includes over 1,200 studios in all 50 states, and they are also over 23 countries. And it's they really expanded very aggressively over the past 5 years. As of 2020, the chain has over 1 million members, but we were just talking before this, that was pre-COVID. And so that number's come down a little bit, but I'm sure that number's going to go back up as soon as this pandemic starts to resolve. And so, Coach Vic, welcome.
Excellent. Welcome to all of our guest panelists, and I'm going to turn this over now to Dr. George Delclose.
Hi, everyone. Glad you could join us today. Every week that we give this webinar, I provide an update as to the situation in the state and also in our area in Houston. I think everyone has been hearing on the news that lately the situation is not good, unfortunately. So what we have here, and we track a variety of different indicators. What we have here is for the state of Texas, the most recent data as of a couple of days ago, the trends in the total number of new cases of COVID beginning back in March, back here, and then as it's gone through the shelter in place, you see that originally when shelter in place was implemented around the 3rd week of March or thereabouts, and 2 weeks later, we started to see the effects, the beneficial effects of that shelter in place, with the numbers flattening off and almost and beginning to hint that they might start declining. Then on May 1st, pursuant to the governor's order, we began the reopening by phases, and initially there wasn't much of a change, perhaps a slight increase at 2 weeks. That led to the Memorial Day weekend, which was at or about the time of the 2nd phase of the reopening. And now 2 weeks later from that, we started to see a definite change characterized by a marked increase in the number of cases that has continued to grow and in fact has been accelerating in the last week. It is true that at the same time, the number of tests that are being performed has increased. And so the question arises of whether this increase could be attributed to just more testing. Our statisticians here at the University of Texas School of Public Health have looked at this model and have adjusted it for testing, and that's what you see on the slide below. The red line shows a definite increase in the number of tests since March. I think everybody is aware of that. You know, more and more testing sites are available around the state. But you'll notice that the blue line, which are the new cases, don't parallel that increase in the test, but actually they are rising at a much faster rate than just a simple increase in the number of tests would account for. So whereas it is true that new testing or more testing might account for some of the increase, it is definitely not accounting for all of the increase. Next slide, please. We also look at other indicators. One of them that you may have heard, because it's one of the ones that the governor's office monitors, is called the percent positivity rate. That means out of all of the tests that are done, how many of them are positive? What is the percent? And the desirable range is generally around 5 to 6% or less. That's really less than 5%. That's what we mark with the green bars here. As it increases, the number of positive tests, our level of concern increases, because that means that there are more and more cases that aren't reflected simply by, again, by an increase in the number of tests. And you'll see that currently, since about May 24th, or actually really since about May 31st, Memorial Day, well, the Memorial Day period, May 25th was Memorial Day, we've seen a steady increase in the percent positive tests, so that we are now nearing 9 to 10%. We're not in the red zone yet or the orange zone, but it's going up, and that needs to turn around and go down if we expect to have an impact on putting the brakes on this disease. Next slide. Other indicators that we look at, you've probably heard on TV as well, that hospital capacity is beginning to be strained a little bit. Overall, across the state, we're in pretty good shape. There are some hotspot areas, Houston being one of them. So what we see on this graph is in the orange line up at the top, you'll see that these are available Texas hospital beds. This is all types of hospitals. Excuse me, all types of hospital beds, all types of wards, et cetera. And you see that they are steadily declining. Now, that doesn't mean that it's all due to COVID, because many of these are also due to patients with other diseases that are being hospitalized that for a while were not being hospitalized because hospitals stopped admitting them in order to prepare for a surge in COVID cases. But then as the hospitals began, as the rest of the state began to reopen, the hospitals did too. And so they are now taking, for example, elective surgeries that were put on hold. And so that fills up beds too. The green line shows the number of ventilators available, and it's been pretty steady. We have enough ventilators in the state. The blue line shows a different trend. Now it's a specific type of hospital bed. It's the ICU beds, which, as you know, can be used for treating the most severe COVID patients, especially those that are at the greatest risk of dying. And you see that as the number of hospitalized patients in red has gone up, the number of ICU beds is going down. Now that's across the state. Next slide. But we need to remember that these are just state numbers. They're average numbers. But if we look at, and this is from the Johns Hopkins website, we look at the map of Texas here, what we're seeing in different shades of colors is what we call incidence rate. So this is the number of new cases in particular counties or areas within the state. And you see basically, without going into the details, that there are a lot of different colors in Texas. And so the darker colors in the San Antonio area, for example, the Houston area, Amarillo up here, are where these are hotspots for cases right now. And the lighter colors, like the Big Bend area or close to there, are lower cases. So the variability matters to you as individual employers, because even though you need to stay abreast of what's going on in the state, you need to stay especially abreast of what's going on in your locality so that you can tweak your business and the response that your business has to changing trends much more locally. Next slide. And so as an example of that, here are the data for Houston. And you'll see that in Houston, initially, the effect of the shelter in place was very good. Not only did at 2 weeks after the shelter in place started, did we start to see a leveling off of cases, we in fact started to see a decline. And so when Houston began reopening in phase 1 on May 1, it was in pretty good shape. And as a matter of fact, for the first 2 weeks after phase 1, it did pretty well. There was barely a change. But as phases 2 and 3 set in, and especially after the Memorial Day weekend, we're starting to see the exact same acceleration in number of cases that we are seeing statewide. And again, looking at the graph below, this is not explained only by increased testing. The red line is, it's not flat, it's growing a little bit, but the difference in the slope of the blue curve, which are new cases, compared to the slope of the red curve is very different. So it tells you that new testing is not explaining in its entirety the alarming rise in cases. Next slide. Now in the medical center here in Houston, because of this, we monitor a series of indicators, what we call our early warning signs, with respect to the capacity that the Texas Medical Center has to be able to absorb a surge in COVID cases. And I'm not going to go into the details. There are about 5 different indicators that we follow. And over here on the right, where it says current status, we label each of those indicators in red, green, or yellow. Green is good, and so you see down below that we have now what used to be a problem, which is not enough personal protective equipment for healthcare workers. We are doing just fine in that area. But the caseload that is impacting the ICU occupancy beds, that is in red already. So even though we still have ICU beds, if we continue at the current trajectory, it could mean that at least in the Houston, the Texas Medical Center area, that our capacity in the ICUs will be lost in about, to absorb these cases, will be lost in about 2 weeks. And then we have some yellow markers. Generally, the first category has to do with the overall growth in number of cases of COVID, which I've already shown you, and you see that we have a sustained increase over the last many days, and that's why it's in yellow. And the other yellow is the percent of base ICU capacity that we have, which is at about 83%. So we've only got about 17% to go before we get into trouble. And hopefully the trend will change before that happens, if everybody does what they're supposed to do. Next slide. Now, one of the ways that the community can help employers and their own families, if you want testing, tells you if you've got the virus. And we know about testing and where to get it, or you should know. But there are other ways to also keep tabs on what's going on. And one of them is to simply track symptoms. The Harvard University has developed this free app that is secure, where any citizen can track their daily symptoms or absence of symptoms, we hope, on a daily basis. It says it takes 1 to 3 minutes to complete, but in my experience, it takes less than 30 seconds. It's already undergone ethical review, and our University of Texas here in Houston, UT Health here in Houston, is participating in this study, and we would like to encourage citizens to download the app and track themselves. Why? And here, we're going to make these slides available to everyone after the webinar, and so you can get more information by going to these websites. But if you'll give me the next slide, Tommy, please. Here are some of the advantages. Nope, previous one. here are some of the advantages of using this app. You can use it for your own family to record symptoms for all family members, even those family members that don't live with you, but that might be coming to this weekend's barbecue at your house, okay? And allows you to follow whether they are well or not. And for businesses, our epidemiology and biostatistics department is constantly analyzing these data in the aggregate. No identifiers, we don't know who it is, but we know what their zip codes or their counties are. And that's information that could be helpful to local employers if they want to know, well, in my zip code where I have my gym or my hair salon or whatever, what's the situation like? Or the zip codes where most of my clients come from. So we just put that out there. Just to make you aware of it. If you want more information, you can contact our colleagues, Dr. Srila Sharma or Bijal Bala. These are their emails, and they'll be happy to answer any of your questions. Thank you.
Thanks, George. Dr. Rios.
Hi, good morning, everybody. My name is Janelle Rios, and I'm a faculty associate at the School of Public Health, and I'm in Houston. So what I'm going to share with you today very briefly is a well-known and often used public health tool, and it serves as a foundation for controlling hazards in the workplace. The tool is called the hierarchy of controls, and hierarchy refers to the level of effectiveness of each of these controls. And it's usually displayed as an inverted pyramid. And we'll go through each layer of this pyramid in a step-by-step fashion, and I'll do it in 2 minutes. So at the very top of the pyramid here, we have elimination. That is the most effective way of protecting yourself from COVID-19 and any hazard you find in the workplace is to eliminate it. And how do you do that? You practice primary prevention techniques. And those are the things that would keep the virus from entering your home or workplace. So as soon as you walk in the door, you wash your hands. You are very careful with masking and social distancing. Next slide, please. The next layer is engineering controls. And these are things that you don't often see, with the exception of the plexiglass. So engineering controls are things that would isolate you from the virus. So say you can't prevent it from coming in, but you can isolate it from you and your workers. Things like technologies that you put into your air conditioning system, your HVAC system, I don't want to say radio, I want to say to kill the virus or minimize its efficiency or efficacy, increasing the number of air exchanges in the household or at the place of work is an engineering control, and it's very effective. Additionally, cleaning and disinfecting is critically important. And with this, as you use disinfectants, please be sure to use the EPA registered disinfectants, and you can find them online. EPA has them published. If you Google list N EPA registered disinfectants, even if you Google EPA list N, I think it's going to take you to it. I've also got a hyperlink in this particular presentation. And like George said, you will receive a copy of the slide set. Next slide, please. Administrative controls are a method of organizing work in order to keep the workers and the virus from getting together. So what do you do here? Under administrative controls, you want to train your employees on how to self-monitor and how to screen themselves before they even come into the office. If it's possible, have the worker work from home or from another location so they never even bring the virus into the workplace. And as you're in your place of business, practice social distancing. I recently went to a wedding. My niece got married and I wanted to have my hair done. And it was wonderful the way the salon handled everything. We all waited outside until it was our turn to go in. And both I wore and the stylist, she wore a mask. And I felt very comfortable. And I saw her clean everything as I was coming in. and she was cleaning everything that I touched and she was touching as I was leaving. So it was a very nice administrative control, which increased my comfort level in getting my hair cut and styled for the wedding. Next slide, please. So the true last line of defense is using personal protective equipment, and this is the least effective but the most visible that you see out there. Now this is an N95 respirator, and it requires a professional to professionally fit this to your face. This is meant to protect you from the world. So that's why it is fit tested exactly to your face. And that's a process. That's a bit of a process. Next slide, please. And finally, and this is a new layer to the pyramid that we've just added, is community protective equipment. And those are things like cloth masks that you see people wearing out there that are reusable, or the surgical masks that are disposable. And this is meant to protect the community from you in case you are positive, you don't even know it, and you may be spreading the virus. So if you wear this, the viral particles tend to stay on the inside rather than you spreading it out into the world. And it's just a very polite thing to do. It's polite. It's good manners to wear one of these when you're out in public, especially if you're in an indoor location. So I think I have used up my 2 minutes, and I welcome questions at the end. Thank you very much.
Thank you, Janelle. And let's move on to Dr. Mena.
Hi, thank you. I'm the El Paso campus dean of UT Health Houston School of Public Health. And as Dr. Rios mentioned, there are numerous factors to consider in the workplace to minimize exposure and thereby minimize health risks associated with COVID-19. But although we know that this virus is most easily transmitted via person to person through aerosolized droplets, there are some drivers of infection risks based on what we know about other coronaviruses and how they've been transmitted in the workplace setting. And so one of those is not to forget the environmental sources, and such as surfaces and the fomites in your environment, and then understanding how to properly disinfect those, the way Dr. Rios explained with the list in EPA disinfectants, and then considering disinfection contact time rather, and disinfection frequency, and also identifying those high touch surfaces in the areas, whether it's a gym or a hair salon. And then finally, I think one aspect that hasn't always been mentioned when we see published safeguards is the role of the customer, the patron, the client. If the client isn't aware of those safeguards, a very well thought through plan of implementation in a workplace could be disrupted by a customer. And I think I'm looking forward to this conversation, because I think that what we can probably all agree upon is that the grocery stores are difficult to control. You know, those didn't close, and there's lots of people in the grocery stores. When we talk about gyms and personal care services, there is more that personal relationship, if you will, between the establishment and the client. And I think communication, from what I've seen, has been very effective regarding getting that out before, like Dr. Rios mentioned, before visiting maybe a hair care establishment. But I look forward to this conversation later this morning. Thank you.
Thanks, Christine. All right, Bob Emery.
Hi, this is Bob. I'm in Houston. I want to cover 4 points. And again, as others have mentioned, really look forward to the conversation. So some of these points we've already touched on, but I would like to underscore them. Number one is, unfortunately, in the popular media, there's a lot of discussion about the coronavirus or COVID-19, but they keep forgetting to use the word novel. And it's a novel virus. And that's an important point, because there's some stuff we know about the virus, and there's some stuff we don't know about the virus. And so my suggestion to folks is, as you conduct your business and you work with your employees and clients, make sure the expectation is set that the rules may change. And if you just think back to perhaps January of this year, a lot of things have changed along the way with regard to as information evolves, scientific information evolves about this virus. So just the notion of transmissibility without exhibiting symptoms, that was not known early on. And that's why this whole issue of the masking has come up. One thing that I would advise you to track is in epidemiology, there's an important concept called R naught. And R naught is the number of secondary cases that one might expect when you have a confirmed case. But so let me give you some reference numbers just so you understand. So like in the case of seasonal flu, the R naught might be 1.2. So in other words, for one case of a seasonal influenza, we would expect to see in the community 1.2 additional cases if no controls are in place. And that would be things such as masking, things such as immunizations, that sort of stuff. The current estimated R naught for the coronavirus is 2.2, and that number may change. But again, that has to do with if we have a confirmed case of coronavirus, we would expect to see 2.2 additional cases if no controls are put in place. And that's an important one. On the other end of the spectrum, take something like measles, and Dr. Delco's helped me on this because I always get the number wrong, but I think the R naught for measles is like 15 or something, right? Yeah, so anyhow, my advice is just track the R naught value because that's going to probably change as more scientific information evolves. That's number one. Number two is we had a lot of questions about screening, and I bet we're going to get a bunch of questions today about this. Please understand that screening actually begins at home. I'd like to underscore what Janelle was saying, that by educating our employees and our clients that if you're not feeling well, don't come in, make sure you are masked, basic hygiene practices. We have a lot of people that seem to be swayed towards these visible activities of the masking, number one, and then temperature checks. And we have physicians on here that can answer the questions better than myself, but it may be we may be at a point right now where temperature checking is moot. That it's really not helping because we have community transmission, and it could be that people could be taking medications that mask the elevated temperature anyhow. So maybe relying on temperature screening isn't the way to go. Number three here, I believe Janelle has already covered pretty well. There's the notion of masking, that these face coverings and surgical masks are intended to keep you from inadvertently spreading the virus to someone else unknowingly, because as the science evolves, it appears as though people who are asymptomatic still have the ability to transmit the disease unknowingly, and therefore that's why there's this emphasis on the face covering. But that's different than PPE or personal protective equipment, as the Janelle showed, the N95s, there's other ones called P100s, PAPRs, others. Those devices are intended to protect the wearer. And we have focused on making sure that we have those supplies for our healthcare providers. And so there's been a lot of discussion about, well, should everybody have N95s? Well, hold on now. There's a finite number of those things. We got to take care of these frontline healthcare workers first, but the supply chain seems to be firing up. And I could envision in the future, and we can have this discussion, that in other professions where people have close contact with their client, like in hair salons or like a dentist or whatever, that you're going to see more and more use of things such as N95s rather than the face coverings when you're in close contact, close proximity to your client. And then my last comment here is cleaning and disinfection. As was mentioned, you want to make sure that if you're doing the cleaning yourself, and maybe you're mixing these materials, or you have a contract housekeeping service, make darn sure that these EPA, that the disinfectant that they're using is an EPA registered disinfectant, and that they're mixing it to the appropriate proportions, and they're adhering to the residence time. In other words, how long, what I see a lot, right, as I just travel around, is we got people that are diligently cleaning, they go in and spray a door handle and then immediately wipe it off. Well, there's a stay time to this stuff as well, a residence time. And so that's really, really important. And I think as Janelle was mentioning, where she just went to have her hair done, if there could be a pressure to churn more customers through, we have to educate those customers about the notion of the stay time for the disinfectant to actually take hold. So, and then with regard to environmental persistence, we get a lot of questions about how long might the virus be viable on a surface. It varies by the substrate or whatever the material it may be on, but a good rule of thumb is 72 hours. That's kind of an average of the different ones. There's been issues about cardboard and other sorts of things. And then last but not least, I don't have it on the slide, but the notion of air exchanges within your facility, and then the different controls that you might put in place. And then we have a lot of questions about UV disinfection. You can actually buy these devices, and it's UV lights that fit in the ductwork. And that's true, and they can be effective, but I just forewarn people, you get a system like that, it's like getting a puppy. You got to walk it, you got to worm it, you got to feed it, you got to maintain it. And so if you are attempting to rely on something like an inline UV disinfection system for your ventilation system, make sure you understand the commitment to maintaining it. So I'll stop there and look forward to the conversations that go along.
Thanks, Bob. Let's move on to our next slide here.
Expect a full book report. There, read all that.
All right, Dr. Dufresne.
All right, so I'm David Dufresne. I am here in San Antonio at our San Antonio campus, and my responsibility and assignment was to provide you with some resources. Bruce, I see you asked a question on here that you're an owner of a gym, and you're asking about where you can find information. And so I would encourage you to look at some of these resources on this particular slide. I've included the CDC, some information from that they have put out for business owners and employers. Put a couple of links there from the Occupational Safety and Health Administration, which is the federal regulatory body as it relates to making sure that workplaces are safe for the workers. And I'm going to talk specifically about that second OSHA link on the next slide. I've included what our state government has put out, as well as what the U.S. Chamber of Commerce has put out. And then lastly, the very last one there, the American Industrial Hygiene Association, I would encourage you to go and look there. They have put out some great resources for a multitude of industrial sectors, including hair salons, nail salons, and workout facilities. Next slide, Tommy. I have received several questions, inquiries on how OSHA is enforcing COVID cases in the workplace. And I just wanted to bring your attention to this on how you should treat OSHA, what they call an OSHA reportable and an OSHA reportable. There are two different situations here. A recordable is what injury and illness you put on OSHA 300 forms. And according to the OSHA definition, there are three criteria for COVID. One is it has to be confirmed with a test. It has to be work-related, and it gets medical treatment beyond the typical first aid. It also results in the worker being off work or loss of consciousness or, unfortunately, death. And so you do have to record if it is a work-related COVID case. But the question is that I'm hearing from multiple employers, how do we determine if this is actually work-related? That's the question, and it is a challenging undertaking. And so OSHA has provided a little bit of clarity on that very question. For one, they want to look and see if you conducted an investigation, how thorough your investigation was. Was there evidence even available to you as an employer? But then also they're going to look at such factors. Was the worker working among other workers that you did have some other cases in the workplace? That could be used as evidence as being work-related. Or if the worker was involved with interacting with the community while on the job and there was an outbreak or an increased number of cases, that might be evidence that OSHA could use. So it's very specific to the workplace, and they would take a number of pieces of information and evidence and trying to decide if this truly is work-related. If it's a reportable, that is when you have to actually call OSHA up and say, we have a COVID case. And that COVID case, if it is work-related, has to result in a fatality. They died if they were in the hospital. You have to report that to OSHA within 8 hours. Or if they were hospitalized, notify OSHA within 24 hours. But that's only if it is work-related. And you have to make that decision as a business owner or an employer as to if it is work-related. And so there are a lot of questions out there, and if there are questions, you can contact your local OSHA authorities or offices, and they can help you determine if it is work-related. So I'll put that out there. The second OSHA link that I put on the preceding slide addresses this information. In fact, I copied and pasted directly from the OSHA documentation. So I'll shut up and we'll move on to the open discussion.
Thanks, Dave. Absolutely. Thanks for everybody's insightful information. What I'll do is I'll ask Coach Vic to jump back on his webcam so we can see his lovely face. Let me just go ahead and jump into some of the questions that have been submitted. And the first one is specific to a gym. This attendee says, I'm a part owner of a gym. Can you provide any information on opening up the gym and mask requirements? So I would imagine that some of that is probably from Dave's slide here. That probably gives some of that guidance information. But maybe if Coach Vic, you want to kind of give your own personal feedback on what you guys have been doing to open up and those mask requirements. I think you're on mute, Vic. Happens to all of us. Can't hear you yet.
AirPods. Can you hear me now?
Now we can. There we go.
Yeah, we're good.
Yeah.
There we are. Technology. You know, what can I do? Let me see. Where was I going? So if we haven't opened yet, one of the things that we jumped on right out the gate is when we did have an opening date, we started training immediately. We brought back our staff and started going through all the scenarios, right? All the problems on how to respond to our members coming back through the door, and then how are we going to do it so that we continue to keep our doors open. So we went through role playing top to bottom, and we have the privilege with Orange Theory that we have a medical advisory board in corporate that helps line us up with everything that we needed to open in regards to our cleaning equipment and processes. But for the staff specifically, when we got an opening date, we had everybody in wearing masks, full PPE prior to. So if you were coming through the doors, you were wearing a mask as staff already out the gate. Just get used to it. And gloves. I know there can be a discussion about gloves, but that was the recommendation for us. We got those rolling right out the gate. When it came to members, we followed the CDC recommendations in local government where we said that it was recommended, but we couldn't mandate it at the time. And that still seems to be the recommendation now. We have recently come to mandatory at the door, entering and leaving the studio. And all of that communication just came within our classes. We still have long breaks in between, and making sure that we're contacting those members both on email and as announcements. Social media has been a big help for us as well. Great to answer some of those questions. I'll keep going. I'm a bit of a talker. So.
Well, and I would just add, since Texas, not as of today, it's not a statewide requirement to wear masks. So I would assume that every local, township would need to, that person would need to look at what their local ordinance is. In Houston now, in Harris County, it is a requirement for businesses to require masks of their patrons, but that's not the case in all counties and all cities. So definitely look at your own specific area to know what that law is for your area. Let's see, where did my questions jump off to? I know that our esteemed colleague, Dr. Whitehead, had written in and asked maybe if George is familiar with that voluntary symptom study on the estimate of how many people in Harris County have symptoms that fit into a COVID type illness. I think Dr. Whitehead said it looked like it was pretty low, meaning that, you know, not all symptoms that people have are going to fit nicely into a COVID-like illness, which is kind of what throws us for a loop. You know, some people can just present with a sore throat or a headache or, you know, something vague and not necessarily that classic, I've got a fever, I've got a dry cough. So maybe, George, you want to talk in general about some symptoms that we know about?
Sure. So I don't know any results from the symptom tracker locally, but you're right. So we have looked at some data here from the medical center, and it's interesting. It's a very good example of what Bob was saying, that this is a novel virus and we are learning all the time. You may remember that at the very beginning, back in January, February, when the CDC was giving a list of symptoms on which they were giving us symptoms to healthcare providers to know when to test. Initially, they all required, first of all, having a fever, and then maybe having some other symptoms like cough or shortness of breath. But you had to have a fever. We now know that in the majority of cases, there is no fever. It's a common symptom, but it's not 90%. It's closer to like 40 or 50%. So what does that mean? It means that early on, when we required a fever, we probably missed a whole bunch of cases. When we look at our data from some of the hospitals here, the most common symptom is still a cough. And that's at upwards around 80%. Then it's followed by fever at a good distance, loss of sense of smell, shortness of breath. And then you start getting into the vague stuff, right? So the headaches, the muscle aches. And Tommy is right. Many of these symptoms are nonspecific and they're common to other things. So for example, if somebody comes to me and they haven't been around anybody with COVID, and they tell me that they have diarrhea and a little bit of a muscle aches, I probably won't test them for COVID. But if that same patient tells me, oh, and by the way, I just found out I was exposed to somebody who is positive and I was at a close distance and I wasn't wearing a mask, etc., then I'm going to be more likely to test. And so that reflects a measure in epidemiology we call the predictive value. That means when I take a symptom that may be vague in this case, but it happens to be in the setting of a real exposure in this case, the likelihood that that vague symptom, otherwise vague symptom, is due to COVID goes way up. Okay? What's called an increase in the positive predictive value. So we have to take them on a case-by-case basis. But at the same time, CDC has been lengthening the list of symptoms that they have attributed to COVID. All right? So it's a roundabout answer, but the most common things are still cough, fever, loss of sense of smell, shortness of breath, and then some other things like headaches, nasal congestion, sore throat, etc.
Thanks, George. Chanel, did you have any comments?
I did. So I just got on the symptom tracker, and I see that 1.6% of Harris County's residents, according to the tracker, exhibit COVID-related symptoms as of June 24th at this time. But it also says that those symptoms change as they gather more information on this particular app and other models that they're using. Those symptoms actually do change, just as George was talking about.
Excellent. Let me ask a question to Janet and Enrique. First of all, are you guys open for business again? And secondly, maybe talk a little bit about what you guys in the salon industry have been doing to ensure that your patrons are safe.
Yes, we reopened May 11th, and before that, we started preparing to reopen the hair salon by labeling just all over the salon, you know, things as simple as if you want to look at our hair product, please contact the hairstylists, instead of just grabbing stuff, we put hand sanitizer outside the door, at the reception, on every station. And we wear masks, face masks, and we wear a shield. And we try not to talk when we're shampooing the client since we're directly above them. And then most of the work that we do, we're standing behind them, but we're wearing our protective gear at all times. At the hair salons, typically, something that we like to do for clients is allow them to change so that they don't ruin their clothes. So we let them know ahead of time, either through a text message or phone call or social media, that we were not going to be allowing any changing. We asked them to wear maybe not their best clothes so that they could put the smock over without actually changing. We were locking the door initially to make sure that we didn't have any unnecessary guests. We asked our clients not to bring additional friends or family with them and to wait outside. And that way it would give us a time to clean our stations. You mentioned earlier about the EPA. We use barbicide and it requires a 10-minute contact. So even when we were running on time, we gave ourselves that kind of space so that we could spray down our chairs, our shampoo bowls, 10 minutes for them to actually be sanitized. Then we'd send that client a text message and say it's now safe for you to come up.
Hey, this is Bob. I'm curious, did you, are you taking some of the chairs out of service? I don't know if that's the term you referred to it as, but
Yeah,
when I think of going,
we're doing that as well. We're a total of 6 stylists.
Uh-huh.
There's 7 chairs, and we removed 3 chairs. So there's space in between. We also have 3 shampoo bowls, and we're currently not using the one in the middle. That way there's like a 6 feet distance from client and stylist shampooing.
and then Tommy, I'm not sure I'm allowed to ask questions. I'm kind of curious.
Go ahead,
Have you extended your hours? Because if you've taken some of the chairs out of service, but to be financially viable, you still want to have the throughput, I would think, of the people to get their stuff, including Christy, right? Christy's got to get her hair done.
Exactly.
So,
Yes.
so you've extended.
Yeah, so what we've done is we developed a schedule so that we could all be here even amount of days, so that we could rotate Saturdays, because our clients at work, they still prefer Saturdays. So we don't have more than 4 stylists at a time. We've definitely started coming in at 8 instead of 10, work later. Sundays and Mondays, which were usually days that were not available. Those help everybody because we don't allow any double booking anymore. For the time being, it used to be an easier way to get more people in and make more money, but currently we work 1 client at a time, and we make sure that we don't have unnecessary guests in here, just contributing to overpopulation of the salon.
And then Coach Vic, I'm curious, I don't know if your operation is a 24-hour deal, or did you guys expand hours to kind of be able to space people out?
So we are boutique fitness, so everything is reservation based. We have an app on your phone and/or contacting the studio, so everything is basically on appointment. What we were able to do, which was a little bit different on the model, so I'm glad that you brought it up, Doc, but we were based off of occupancy prior to. And so you mentioned it was traffic, trying to get as many people through the door. We're very big on community, talking, gathering in the lobby, that type of deal. And the world we're in now, we had to pull all that out. So we've taken all the chairs out of our lobby. We still ask people to stay out front. We came back when we opened the doors with, on average, about 10 more classes a week in every studio than when we closed. With the decrease in capacity, we had to increase opportunities. And we noticed as well that, maybe not everybody's back to regular world work again. So some of those downtimes in the middle of the day that wouldn't engage members are now doing it 1:45, 2 o'clock in the afternoon. We run 7 days a week. Our weekends are a little bit longer, on average by 1 class more, to help satisfy our member bases. So we've done all of that too. Doors are locked at the front, and all of our staff is 100% required PPE since the day we opened the doors. So we do temp checks at the beginning. I know that those are on there, as well as a questionnaire for all coaches and sales associates and members. So before they come through the door, we ask them, and we have to hear verbal confirmation that they're not having any issues. And we also ask all of our members to stay out the doors until right between 5 and 10 minutes before class starts. And then we can only allow one person in at a time to get to their station. Everything is reservation based. And we have every other station in use. We brought the tape measure in for that one too, and we made sure that we have 6 foot on either side. So if you're in a hula hoop and spinning, you don't hit anybody. So we have all of that spaced out within our studios as well.
Interesting.
Excellent, excellent. George, before, I know you've got to jump off in a few minutes. There was a question that was written in about testing and the accuracy of testing, PCR versus some of the new rapid test kits, maybe the antigen kit. So I know you and I just watched a short video on some of that, but do you want to kind of comment on the types of testing we have available and what their accuracies are?
Right. So the most accurate for detecting an active infection, that means being sick right now, is what's called the PCR. It's the one that you see on TV where they're sticking a swab all the way back to the back of your nose. So some people describe it as feeling that they're shoving it up into their brain. It's not comfortable, but it is very accurate. But that tells you about current infection. And then, and that one typically takes a few hours at the least to get a result, and depending on how backlogged the lab is, some of the commercial labs are taking 4 or 5 days to get a result back, but it is the most reliable. There are some rapid assays, probably the most commonly heard and used is the Abbott 15-minute test. This is the one that you've heard on the news as, it was touted as a wonderful addition early on because you could get results in 15 minutes. And then as more and more testing evidence accumulated, it appeared to have some issues where it was not as accurate as one would hope, especially with respect to giving you what the one we worry about the most is false negatives. That means you do the test and it comes up negative, but you actually have the infection. There can be reasons that go beyond the simple accuracy of the test itself. Maybe the sample wasn't obtained correctly. Maybe it was obtained too soon, because after you're exposed to somebody with COVID, it takes a few days for these tests to become positive. So if you test a person the same afternoon that they were exposed, it's going to be negative, and you may already be developing the disease. So we typically wait about a minimum of 5 days after the exposure, as long as people don't have symptoms, to do that test. But then there were problems with the accuracy of the tests themselves that were reported. And so many places have pulled that back. In our hospital, one of the hospitals that we work with, Memorial Hermann, it's actually performed very well. And the way we know that is we've done the test and then we've done the PCR, the gold standard, back to back. And usually they've agreed pretty well, but that hasn't been the same experience elsewhere. And then there are antigen tests, which Dr. Heisler is familiar with, which you take a nasal swab and you're looking for parts of the virus, but it's not as sensitive as the PCR. So the concern there is, again, they might not catch all of the cases. And then finally, we've heard a lot about antibody tests. Antibody tests, the useful ones, don't really tell you if you're having an infection right now. The one that was supposed to isn't working out so well. And so you may have heard of something called an IgM, an immunoglobulin M study, and that most places are abandoning its use for COVID-19 because it's not reliable. Instead, what is more promising is the IgG, the immunoglobulin G, because that detects people who have had a past infection, even though they might not have known they had the infection. And so it's important for us to know, what % of the population has that IgG, that evidence of a past infection, because that's very useful information for knowing how we are doing in terms of making progress towards protecting the entire community. But it needs to be used appropriately. And so right now, all we know is that people who have had that infection have an IgG level that is elevated. it's positive. We don't know if that necessarily means that they are immune or protected from another infection. And if they are protected from another infection, we don't know how long that immunity lasts. At this point in time, we will know, but it needs a lot more months of data to compile.
And George, just for the audience, that the IgG test is a blood test, not a nasal swab.
That's correct. Sorry,
Yep.
it is a blood test. Yes.
It's just a finger, but it's just a finger prick, I believe, correct? Or no? Is it
It can be a finger prick, and there you can take actual blood from a vein. The one we do is actual blood from a vein. You know,
Oh.
we're biased. More is better. More blood is better.
But to follow up on that, a question was written in about what are we doing at the Houston Safety Council as far as testing? Are we testing, you know, return to work people, trying to get people back to work and making sure they are not infected, or are we testing people with symptoms? And the answer is we're testing people to get them back to work, to make sure that they are not infected, but we're trying our best not to see sick individuals at our clinic. Those sick individuals need to go see their own doctor or a county health clinic and get tested. We're doing our best to just see you know, assumably well people to make sure that they are okay to get back to work as much as we can. So thank you for that question as well. All right, let me jump back up here on my screen here. Question, and Bob, you're up on the screen already. So, you know, when we talk about specifically N95 masks, and when people in the public have those N95 masks,
Yes.
the first part of the question was, how many times can we use it before we need to toss it in the trash? And the other, more of a comment, was the public needs to understand that that is a respirator, that it needs to be worn in a proper way with proper technique, a proper tightening to assure a safe seal. So maybe you can talk about how long you can wear that mask before it needs to be tossed, and then how to make sure you're wearing it properly.
Sure. Well, in a perfect world, so let's go before COVID. In a perfect world, the idea was that these N95 masks would be worn by the healthcare provider, and then after they treated the patient, they would then be disposed of. But now the notion of extended wear became important because there was a shortage of the supply chain for N95s. And then there was this issue of the, and I believe it was Dr. Fauci brought this up during testimony just the other day about the, one of the reasons that early on in this whole event, it was unclear that transmission was occurring when people were asymptomatic and just by having conversations. But the concern was if you have public masking, there could be a big rush to buy up PPE by the public. And we really need to reserve that for the frontline healthcare providers. The supply chain's now beginning to fill in, and I think you're going to find these more available for others that can get them. But you're right, they need to be fit tested. So the folks that we have here at the Health Science Center, they put the device on. We actually have a measurement device after it's strapped in. It can actually measure the concentration inside the mask as compared to the concentration of stuff outside the mask. And you can see that if you're getting a good fit for that, then we normally advise folks to, if it becomes soiled or damp, we're getting to the hot time of the year where these things, when they get saturated like that, it starts to impact its ability to work well. So that's a bit of a judgment call. But I will tell you, interestingly, early on in this, there was such a shortage of particularly N95s that we actually got in the business of reprocessing them. And so at our sister hospitals, the masks were used, and then if they were not visibly soiled or damaged, we actually exposed them to vapor phase hydrogen peroxide, which, by the way, OSHA and NIOSH did allow, just so that we would have a suitable supply of N95s for these devices. But in an industrial setting, you know, the typical thing it would be that you have to have as you well know, you have to have a health history questionnaire for the individual who's wearing. If they're having to wear it for work, you know, they're supposed to do the medical clearance piece and then the fit testing piece there as well. I think, Tommy, I think you got.
I was muted. Thanks, good catch. So I think you hit on it, but you know, the CDC came out and said, let's forego fit testing on the N95s, because when you fit test an N95 mask, you got to poke a hole in it, you destroy it for that test. So they said, you know what, just wear them. You know, there's several YouTube videos out there that you can watch and teach yourself how to properly put on that N95 respirator and make sure it's got a good seal. Just, you know, if you're going to go to the length of wearing an N95 mask, you want to make sure you're wearing it right and that it's doing its job. So thanks for Dr. Whitehead for jumping in there on that question as well. Let's talk a little bit about air circulation, air filtration. I would imagine that, especially in a gym, when your customers are huffing and puffing and sweating and slinging sweat everywhere and blowing out hot air as they're exercising, the use of filtration and circulation in the HVAC system is probably even more important. So, Coach Vic, you want to talk a little bit about what you guys are doing with not using fans or using fans or the circulation? What are you guys doing?
Yeah, absolutely. So upon day one opening, it was clear across the market that we would not use fans. That would be overhead fans for sure. And then also, if you've been on a treadmill before, if you haven't, let me know. I'll hook you up with a free class, right? But over on our treadmills, we have a fan as well. We went through with maintenance prior to, and we disabled all fans. So we have no fans on the treadmills, and we do not use any overhead fans either. We keep all doors open, so the HVAC is just running, and that's our only means of circulation. And all doors remain open within the studio. Outside doors, of course, are locked. This way, we don't have anybody touching doors or door handles along the way, so we minimize that as well. But that's our stance on the fans.
So, Bob, you want to chat a little bit about why, you know, air circulation is so important with this virus?
I will, but I'm just kind of curious of Janet and Enrique, how about you guys? Because you think you probably have blow drying, you've got other activities that could aerosolize stuff. So are you doing anything different there? Or I assume you're in leased space, your salons are in a leased space, so that the HVAC system is run by a commercial firm, is that correct? Or?
No, actually, the HVAC is run by us. We have 2 units.
Okay.
And we're running them at all times, and we do have to open the door to allow for circulation. So we'll do that for maybe about 10 minutes, and then we close it again.
Okay. Okay. The reason I ask this is that we just completed a study looking at our outpatient clinics and looking at the potential for could we have some sort of disease transmission with it, as it might relate to air exchanges. And it warms my heart to hear Coach Victor say, first of all, don't use the fans, because all you're doing is just stirring stuff up. But the notion of having outside air come in rather than just merely recirculating the air in the room is an important feature. And I can tell you that at least in the clinics where we do aerosol inducing procedures, so let's say bronchoscopy or something like that, that the recommendation is 4 to 6 air changes per hour. And that's the reason I was asking the question about the lease space, is that that might be, you know, my advice would be make sure you're getting outside air coming in there. And number 2 is see if you can if you can measure it yourself, or if you're in, like Coach Vic, are you in lease space, or you have a group that manages it for them to report what are the air changes per hour, because I agree with Tommy. I would imagine that in a particularly a gym, that you'd want to be shooting for something along the line of 4 to 6 air changes per hour in a facility where you got a bunch of people huffing and puffing. But the other side of the coin is you don't have the patient load, or you don't have as many people in there at the same time. So just a rule of thumb there, just something to think about. But that notion of having outside air instead of just recirculating is important.
Definitely. Let's chat a little bit about, I think we've touched on it along the way, but I'll start off with Janet and Enrique. Talk to us about what you guys are doing to sanitize the area for your customers. How often are you doing that? Are you doing that in between every person, along the way in between every person, or while you're handling a customer? What are you doing to ensure that your work environment is safe for that customer.
So pre-COVID, hair salons were supposed to be doing a lot of sanitizing between clients anyways. And so we do spray down the shampoo bowl and the working station between clients. We do have one extra hairstylist who walks around and is keeping the salon clean at all times. If we were to drop a utensil, for example, she picks it up and takes it to clean. So first we wash it with water and soap. Then once it's been disinfected, then we put it inside of barbicide so that we don't contaminate the barbicide. And this is something that we change out daily. Another thing that we changed as far as the way we take care of our clients is the capes that are typically, you know, cloth to cut hair. We wash them in between clients, and we also use trash bags. And the trash bags can get a little warm, but we cut them. They're very lightweight. We cut them so that we can use them as a cape, and at least the client sees us make a new one and throw it away. And I always joke with them, you can take it home if you like, it's yours now. But that's just, you know, things that we do for our clients. We like to do it in front of them. We like to offer them a hand sanitizer. So before we start, you know, we also allow them to use it. And unfortunately, one of the things that we can't do anymore is we don't offer any coffee or tea, which we normally did, just because, you know, we're so that they know that we're not, you know, maybe giving them a dirty cup.
That's great feedback. And, you know, I think you did touch on it, you know, doing as much as you can in front of that customer while they're watching is key, right? Even when I walk up to a grocery store and I got to go get a basket, makes me feel a lot better when I see that worker wipe down the handlebar of that basket before they give me the basket. So I think that's good just for everybody's own psyche, right? That, hey, I know I'm going to sit in this chair and I just watched them wipe it down. So I know they've done everything they can to protect me. That's not always feasible.
Another thing I'd like to add is I mentioned if we were to drop a comb, but we do have a box where we sanitize our implements. And even if we didn't drop it, just between clients, every time that we switch out a client, all of the clips and combs that we use goes to sanitize. The only thing now is that we have it out in the open. So when we're shampooing a client, they actually see where we keep, you know, the clean combs as opposed to the ones that we've just used.
Excellent. Well, I'll ask the same question to Coach Vic, because obviously, you know, like we said, a gym can get dirty, right? I mean, we're going to sweat. We're going to touch everything in our way to dumbbells and a treadmill. I mean, we touch things, right? So what are you guys doing that's you know, helping to ensure that safety?
Yeah, so we changed up everything from entrance to exit in the studio when it came through. And to jump on the point as well, doing everything in front of our members and shifting our importance. In the beginning, pre-COVID, it was high fives and hugs and laughing and joking. And we've shifted that over to, let me show you how I'm taking care of you by keeping you safe. So by creating that value, the first week or two was not super seamless, but we've gotten very good at it. So at the front door, everyone waits outside. Upon entrance, the only thing a member can bring into the studio would be anything that fits in a small plastic bag. So we have a small plastic bag, like a grocery bag, and they'll put their keys and phone in there. We're not allowing bags, outside clothes, any of that inside the studio. We ask them questions if they're feeling, aside from working out, fatigue or muscle soreness. We check their temperature at the door, and then we allow them in from there. Upon entry, we spray. We have different consistencies of alcohol, right? So we'll spray their hand with a little spray bottle so they can clean their hands. They have a designated locker, and then they go directly to their location, whatever their start location is. So we control traffic and maintain our distancing within the studio all the way through their station. Each station is separated with at least 6 feet. We have at least 6 feet. So we use, in our case, we have a line of treadmills. We'll use every other treadmill. And that gives you about 7 feet from center line to center line. So we have plenty of opportunity to keep separation. We typically will work off of odds and even numbers. So what I mean by that is if you're on an odd number treadmill, you're likely on the other person is on an even number rower. So the opportunity to kind of cross ways is minimized. And then of course, when we transition throughout, everything is very process-based. It's very militarized, so to speak. No one can move until the coach allows the movement. We have wipes in between every rotation. We'll hand out a brand new wipe to everyone. We have alcohol stations, hand sand, whether different consistencies, up to the members' use, their discretion on which ones they'd like to use. And we wipe down everything in between. We allow 30 minutes in between all of our classes, minimum of 30 minutes where the staff goes all hands on deck. We lock the front door and we wipe all the equipment. It's all pre-mixed. It comes to us. We use Cintas, and we have some other cleaning supplies that are here with us. We put on the mask, the gloves, and if it's all touchable equipment, we're wiping it in between every class. It's a bit, tedious. It is a process to go through, but the idea is to believe, and this is something that, I share with my leadership, just believe that one person that came through the door has COVID. If you believe that every single class, you have to clean everything. Of course, that's not the case, but you want to have that idea so that everything is as clean as possible. And then upon exit, it's still structured on the way out, and we'll still spray their hands on the way through as well. So you're clean when you're coming.
So, Coach Vic, this is Bob. I'm just curious because you're part of a much larger organizational chain. Has there been any discussion about using these vapor phase hydrogen peroxide misters? Or some of your colleagues doing that? Or
it's likely coming. But we haven't actively started using it. It is in discussion. I do believe it's in our near future to be using as well. And then part of that, are we skipping? Hope y'all can hear me. Part of that is we have cleaners. We have professional cleaners that will come by most studios 3 to 4 days a week in the evening when business hours are closed, and they'll do a full clean as well. And we have a backup plan. There was an instance where if we had someone who tested positive for COVID that came through, they'd be able to mist and deep clean our entire studio as well. So we have that as a backup plan. We are moving towards
that would be performed by a commercial or a contract firm. Yeah. Okay.
Correct. Yeah, we would do all the, I guess you call it housekeeping clean, but we do have professionals that will come through our studios at least 3 nights a week on rotation. And then we have the opportunity, if we ran into an issue where there was a member and or employee who came through, did test positive for COVID, we have a company that would come through and on the whole place.
Well, that furthers another question, and I'll ask it to both of you, but I'll start with Jonathan and Enrique first. I'm sure you're doing a screening type questionnaire, right? Or asking those questions when they walk in the door. Are you sick? Do you have a fever? All that good stuff. And you're probably asking, do you have COVID, right? Have you tested positive for COVID, or have you been exposed to somebody? So what are you doing with those people who answer yes? Maybe they say, yeah, I had COVID, but it was 3 weeks ago. Or yeah, I was exposed to my uncle 2 weeks ago, but I never got sick. What are you, and there's no right or wrong answer, right? I mean, what are you doing? Are you allowing those customers to go ahead and continue? Are you asking that they show you a test result? How are you handling that situation?
So actually what we're doing with that is we're sending that via text because we have a personal relationship with all of our clients. So it's more of a text in anticipation. We don't want to do that same day.
So you're pre-planning
for the upcoming appointment. I personally have a client who I hadn't seen, but she messaged me just to let me know that she did have COVID. And before she was able to come in and make an appointment, she sent me a picture of the screenshot of the result that finally came negative. And then she was, I don't want to say allowed, but that's when we finally made her appointment.
Sure. What about you, Coach Vic? How are you guys handling screening?
Not me again. Here we go. On the employee. On the employee side, if they have come in contact, we allow them to go get tested. We'll hold them off the schedule until we're confident that they have a negative test result. And we've been fine with that. And really, no one bats an eye at that. They all agree and understand why. And then on the member side, if it were to come up, we may have to handle it on an individual member basis when they came in contact and or if they had positive results, because everybody's just a little bit different in regards to whether they had symptoms or didn't have symptoms. If they did have symptoms, most of them, we put them on a freeze and just ask them nicely to stay home. I don't think anybody really would come back twice at it. Most of the people who have come back for us as well haven't had any concerns.
Yeah.
They've been very forward, especially since we're asking at the door. They know they're kind of going to get pop quizzed before they come through.
Gotcha. Christy, did you have a comment?
I did. It's a follow-up question, and maybe Coach Vic already alluded to this, but for all the guests, I was curious how cooperative your clients have been through this whole process. You know, and maybe Enrique, maybe it's going to take longer to make an appointment now because of the new setup. And so for both, you know, both establishments, in terms of the safeguards, how cooperative are your clients?
So first, we've been getting, we came back with a pretty strong percentage of our member base pre-COVID. Close to 65, 70% right out the gate came through and continue to get new traffic day by day. So we're doing pretty well with it. And for the most part, because we've been so forward with everything that we're doing, we're blasting it on social media, we're making member care calls, we are talking about it as part of our announcements within the studios, and they see that we're going the extra step from, you know, spraying everybody down and cleaning in between. I have a nice, beautiful janitorial looking cart that we pull out after every class, so the members see that. And by presenting it and having it out in front, they've all been very cooperative. We've had a great pool of positivity as well. We noticed that throughout this entire time when we were all stuck in our house, that we really need community and working out and being out with people. So the majority of the people that have come through, the vast majority have been positive.
Our clients have been very cooperative. I feel that everybody takes it very serious, and especially because we're the owners of the salon, the feedback that we get back is that they understand that even if they're not scared, that they recognize that there's other clients of other stylists who might be thinking completely differently. And so everybody's very respectful of the rules and very cooperative.
Excellent. That's good to hear. That's good to hear. I mean, anecdotally, I would say the same here, you know, in our healthcare facility. You know, most 99.9% of the people are willing to do what they need to do and what the guidelines are. You know, you had that 0.1 person that thinks this is all a conspiracy and, you know, doesn't want to do anything, but those are few and far between. So that's great to hear on the personal care establishments as well, that you're seeing that same feedback. Another question that came in, probably directed to Dr. Emery. What's the best way to treat a used surgical mask or N95 for reuse? Do you dispose of them in a biohazard waste? Can you toss them in the trash? What do you do with one after you've used it?
Okay, so let's just make sure. So here's the Bob Emery official surgical mask, and these are designed to be thrown away. So there's really no way you can reprocess them. I don't have a cloth mask here. Wait a minute, I do. These are so these are the ones that are you can wash, you know, get at home, wash in soap and water, hang it up to dry. You're in good shape. But none of these, unless they were visibly stained with blood or something like that, they would not be required to go into a biohazard box. But I am noticing more and more litter around the medical center where we're seeing these masks. Maybe they blow out of somebody's car, or there's gloves, and that so the optics of what one might refer to as medical waste, but it's actually, you know, some sort of protective equipment, but it's now littering around the streets. That's going to be with us for a while. It got me thinking about, I'll show my age because I'm looking at everybody on this webinar. I remember way back when the soda cans, the pop top came out, right? I mean, the whole thing came out, and then they were littered everywhere, right? And so eventually that all went away because now the soda can, or the beer can, the thing, goes inside there. So in the same way, I'm wondering how long this medical waste piece is going to be with us here as these things, as I see them blowing around the parking lot and that sort of stuff. But short answer is, I don't, unless it's visibly contaminated with blood, which would be an odd experience, it wouldn't need to go in a biohazard.
Okay. Janelle?
Yeah, so let me jump in here because I spent a good part of my career working for the Texas Commission on Environmental Quality, and I happen to be the medical waste inspector, or 12 it was called back then. So unless you're working in the healthcare industry or you're working, for example, a research project and actually working with an infectious pathogen, it is not deemed medical waste. It's not regulated medical waste. So even if it was soiled with blood, it would not be considered medical waste if it's not generated in healthcare or a research facility. And there's actually a nice big long definition that the state of Texas has. But if it is soiled with blood, you definitely want to be very careful and remove this and carefully so that you don't contaminate your hands and put it in the trash. This is meant to be disposable. So if you wear it the first time, you want to put it on very carefully by holding onto the straps, never ever touching the inside, because remember the inside goes up against your face. And then you don't want to touch the outer part either, because that consider it contaminated. But this is meant to be disposable and not really, you can't really disinfect it. As Bob was mentioning, this is the N95 respirator. Because this is meant to be disposable, but we had so few of them, we were disinfecting them. And I think the temperature is something like 121 degrees for 30 minutes.
I think it's 165.
Sorry, 165 degrees. Oh, thank you for clarifying.
So if I can jump in there for a second, because I probably should have covered this. There's three ways that one can disinfect. If one goes down the pathway of needing to, if we have another surge and now we get a subsequent shortage of N95s, just so you know, there's three ways that they can be disinfected and reused. One is applying heat, which you just described. And so there's been a big push on having almost these easy bake ovens, for lack of a better term, at 165 degrees for, I think it's 20 minutes. And there's published papers on these, by the way, on this. That was one. The second one is exposure to UV light. So 258 nanometer wavelength UV light. And I don't remember the dwell time on that. And then the third one is vapor phase hydrogen peroxide. So you're seeing hospitals in particular using these three different techniques to stretch the supply of the finite number of N95s until such time as the supply chain can catch up. And then, but I think your point, Janelle, is well taken. We see another spike or another curve, we could be right back in the same mess with the limited PPE.
Excellent, excellent. Well, I see we're down to our last 5 minutes here, so we'll start to kind of wrap up. We want to thank all of our attendees for joining. We especially want to thank all of our guest panelists today. I don't think I think to make a general assumption, I think everybody's got to have a haircut, right, at some point. Yeah. And most of us do some sort of exercising, if not go to a gym. So I think this was a great program to present today. So we appreciate your feedback and your guidance. I think it sounds like your establishments could be a role model for other personal care facilities looking for some guidance. So we appreciate that. We hope that you and your team and your patrons all stay safe and healthy. Sounds like you're doing as much as you can do right now. So we appreciate that. Bob, I think this is our last of our series, right?
Well, we had bantered about the notion of doing one more supplemental one about what to anticipate next, and I've made some jotted notes, but we'll have to have a side conversation on that. But sure. I think it would be interesting.
Scheduled one.
Well, yeah. Was I? Oh, do we have one more? Oh, we have one more next week.
Healthcare or other healthcare like dentists and
That's right.
veterinarians.
You're right. Excellent. Well, I was hoping we weren't done yet. So
Yeah.
feel free to join us same time, same place next week, and we'll talk about some more additional healthcare facilities and what we can do to make sure people are safe in those facilities. So I'm going to go ahead and wrap up. Again, everybody that was on and registered for this webinar will receive the slides. You will also receive a link to the actual recorded video. So you can watch this again or send it to some colleagues of yours who maybe didn't get to catch it today. So everybody should have access to all of the content. So we appreciate everybody jumping on today. Again, thanks to our guest panelists, thanks to our routine panelists on there, and we will see you guys back next week.
Thank you.
Thank you.
Everybody, bye-bye.
See you.